As cases of monkeypox increase around the U.S., so do myths and misinformation about the virus. The idea that it is a, quote, gay man's disease brings back painful memories of bias surrounding the AIDS epidemic in the 1980s. Joining us now to dispel those myths and break down the facts is Knvul Sheikh. She's a health and wellness reporter with the New York Times. Knvul, thanks for joining us.
Thanks for having me.
Break down for us how monkeypox is spread and who is most at risk.
Right. So right now, as you mentioned, the virus is largely limited to one group of people, which is men who have sex with men. But what we know of the virus from previous outbreaks where it mainly circulated in some African countries is that it can spread through three main ways. It can spread through physical contact, if you're directly touching somebody's rash or pimples, which are a clear sign of monkeypox, or if you touch contaminated clothing or bedding. And the other way is through respiratory droplets, like if somebody coughs or sneezes. And then there's also some evidence from past studies that the virus can be transmitted from a mother to the fetus through the placenta. But right now, it seems like it's primarily spreading through the physical contact.
If it's primarily spreading in the gay community, I want to ask this question. As a gay man, I'm paying close attention. But as a journalist, I'm also asking, if it's primarily in that community, are we being a little too alarmist in sort of this public health declaration that really impacts everyone, right? What's the answer to that question?
That's a really great question because I think a lot of the scientists and doctors that I've spoken to agree that it's important to highlight who is most at risk right now. And that's not really being alarmist. That's helping people who are most vulnerable be better able to protect themselves. And that's increasing access to and availability of the vaccines, treatments that are needed to contain the virus.
Knvul, does the data show that other groups of people are beginning to contract the virus more frequently? Or, as David's bringing up, should adult men who have sex with men still be the high-risk group?
Well, they're still the highest risk group, although there have been some cases reported in women and young children. Largely, the virus is limited to men who have sex with men. And like you mentioned, it's not a gay disease. The virus can't tell what your sexual orientation is. But because it's spreading through sexual networks right now, through possibly cuddling, through sex, through the physical intimacy, that kind of prolonged skin-to-skin contact, that's why it's not yet in the broader community. So for most people, you don't really need to worry about it just yet.
I didn't realize this, but I'm looking at our producer notes. The first case of monkeypox dates back to 1970. What kind of treatments? I mean, we're talking a lot about the vaccine. Are there any treatments available other than the vaccine right now?
Yes, so there is a treatment called TPOXX or tecovirimat, which is FDA approved for smallpox, a related virus to monkeypox. It has been tested and proven to be efficient in animals, but it hasn't been tested in humans yet. But because the treatment works for smallpox, and we have evidence of that, and monkeypox is very closely related to that other virus. That's why we can use that treatment. It's an investigational new drug for monkeypox as well.
How would the Biden administration's public health emergency declaration benefit those in need of vaccines or treatment?
That's a good point, because the Biden administration just announced that it's a public health emergency yesterday. That can lead to more emergency funding, more development of vaccines and treatments. It could help government agencies hire more people that are needed for tracking and doing the testing and all of that. And it can also compel allow the CDC to get data from hospitals about who the patients are, who's been getting the vaccines. And that's really important for public health to be able to track in order to stop the virus.
Knvul Sheikh with the New York Times. Thank you for your time.
Thank you.